Hello, class. My name is Cecilia Covarrubias, and this is my informative speech on cervical cancer screenings for speech conquest here at Stanbridge University. The purpose of this speech is to inform the audience what pap smears are and then why they're so important to female reproductive health. Let's get started. Did you know that cervical cancer is one of the most common cancers in women worldwide? According to the CDC 2022, the annual number of cervical cancer deaths globally was over 340,000. Pap smears are a crucial tool in detecting HPV and cervical cancer prevention. I am sharing this information with you today because my aunt was recently diagnosed with stage 1 cervical cancer last month. She shared with me her experience and journey of her diagnosis, which then inspired me to go into further research about what women can do to prevent cervical cancer for themselves. Today, I will be discussing what pap smears are, why they are important, and how often women should get them. I challenge my female audience to remember the last time they received their last examination. First things first, what is a pap smear? A pap smear is a screening test that checks for abnormal cells in the cervix. Normally, as you can see in the diagram, this is what a pap smear would look like. Normally, a nurse practitioner or OBGYN will grab a speculum or forceps and insert it into the vaginal canal, where they will then grab a swab or tool to scrape cells off the surface of the cervix. They will then send those cells to pathology for further examination and test results. The duration of the exam is no less than 5 minutes and can sometimes be painful depending on the pain threshold of the patient. Me personally, I am 30 years of age and I've had a few of these pap smears done before, and the pain for me is normally like a mild cramp, really nothing further than that. But you may be thinking, when they send it to pathology, what are they looking for? Which brings me to my next point. Why are pap smears important? Pap smears are important because they are looking for the early detection of HPV. It will be a pap smear for HPV would either be a positive or a negative test. HPV stands for human papilloma virus, which causes abnormal cell growth on the cervix. Transmission for HPV is usually a sexual transmitted disease that requires skin-to-skin contact with an infected person. According to CDC 2022, there are over 150 strains of HPV. Most people will encounter HPV in their lifetime, but the immune system can take over and fight the virus. Of the over 150 variants, 20 of them are associated with cervical cancer. Most pap smear tests are mainly looking for HPV variants 16 and 18 because they are found in 80% of cervical cancer diagnosis. As you can see from this diagram, there's a small look at what HPV looks like. It's a small capsulated virus on the pink. And on the right side, you can see the view of what a cervix looks like from a normal cervix to the early stages to the one of the end stages of cervical cancer, which you can see some abnormal cell growth. It's important to note that HPV symptoms can be undetectable. If there are symptoms of severe symptoms, it would be pain during intercourse and genital warts. If you yourself see that you have pain during intercourse or genital warts in the vaginal area, you should contact your doctor for an examination for a pap smear. Note that vaccinations for HPV can start as early as 12 to 14 years old for prevention. If you have already tested positive for HPV, the vaccination will not cure the infection. Regular pap smears can prevent cervical cancer by detecting and treating abnormal HPV cells before they become cancerous. Which brings me to my last point. How often should women go for pap smear examination for detection of HPV and cervical cancer? Cone Health 2020 recommends that women start getting pap smears at age 21. From 21 to 29, women should get an examination for a pap smear every 3 years until the age of 30. Once they've reached the age of 30, women can get a pap smear every 5 years. Women over the age of 66 can discontinue pap smear screenings if they have a history of normal results and they are not at risk for cervical cancer. Some exceptions: women who have risk factors such as a history of cervical cancer or HIV may need to get pap smears more frequently, such as annual checkups. This exception also applies to women who have tested positive for HPV before. Pap smears are a crucial tool in detecting HPV and cervical cancer early, which can save lives. We have discussed what pap smears are, why they are important, and how often women should get them. By getting regular pap smears, women can take control of their reproductive health and reduce their risk of developing cervical cancer. Here are my references, and thank you for tuning in to my presentation. Thank you and have a great day.